Welcome to Human Potential at Work, the show where we explore social impact, inclusion, and empowerment of everyone, including persons with disabilities. Get ready to be inspired, hear success stories, and learn tips and principles for bringing out the best in everyone.
Hello, everyone. This is Debra, and this is Human Potential at Work. Today, I have a guest that's returning. She actually was on, a couple of years ago, and she was definitely a crowd favorite. So I wanted to check back in, and to be honest, I've been tracking her work because she's doing really, really powerful work. I think you're going to really enjoy this, learning more about what she's doing. And she is determined to make a difference, and she already has. So my guest is Rebecca Palpant Shimkets. Hopefully I said that correctly, Rebecca.
You did great. You did great.
Good. And as a reminder to anyone that's listening to the show, I would recommend you go back. You can go to rootglobal.com and select show and see the last time Rebecca was on when she was working for the Carter Foundation. And so she was, we talked a lot about what, she was doing with the Carter Foundation. And we also talked a little bit during the interview about cancer, which is what Rebecca is really making sure that early diagnosis of cancer, very, very important, and making sure that we're all, doing what we can to, manage, deal, with cancer. So Rebecca, tell us more about what you're doing, because it's very exciting work. I know you're writing, you're consulting, you're doing a lot of very important work. So thank you.
First of all, Debra, thank you so much for having me back. It is such an honor. As I've told you, I admire your work so much, and I know your audience does as well. So it's an honor and a privilege to be here today. So thank you. As a nod back, as you mentioned, for 15 years, I worked for former President Jimmy Carter and his wife, Rosalind, specifically in the area of mental health. And for those in the audience who don't know, Mrs. Carter has had a mental health platform for, oh my goodness, 50 years. She's been working on the issue, and a lot of the work that I did with her during that period was on reducing the stigma associated with seeking mental health care and acknowledging that you have a mental health diagnosis. So many of us do. Right. And we shouldn't be ashamed of it. And, I worked a lot with the media around changing the way we talk about mental illness. And that's just been my life mission. And after surviving cancer twice myself, I'm a 2-time cancer survivor. I'm 10 years clean bill of health. Thank God. I continue this fight, but in kind of a new way, where I am bringing this mental health kind of mission and focus around reducing stigma and changing the public conversation, not only to mental health, but to also cancer as well, and specifically around cancer survivorship. And I look forward to talking about that much more. Right now, I'm doing a lot of writing about this. I'm writing a book about post-treatment survivorship in mental health, is something that is not discussed. Right. And I'm very interested in reducing the myths and misconceptions around cancer survivorship. In addition, I've been working with some really exciting organizations, the National Association of Chronic Disease Directors and the Georgia Center for Oncology Research and Education and others on prevention of cancer, as well as on mental health issues and survivorship. So that's kind of where I am now, and I look forward to having this discussion.
I agree. And I just want to say that I love what President Jimmy Carter and Rosalind Carter have done for so many people, for our country. I just love them. I love them. I love that they just always believe in giving back, giving back, giving back. It's really powerful. And the mental health issues in our country right now, all over the world, that this is becoming rampant. And I'm somebody that my whole life I've struggled with anxiety, depression, and I was diagnosed later on in life as having ADHD, which I think it exasperates the depression. But so many of us are dealing with it, and many of my clients, my corporate clients, they think this is the number one problem that they're dealing with because they're finding that employees they're struggling themselves, their family members are struggling, they are sandwiched in between different generations. I mean, we have 5 generations often in the workforce, and there's a big intensity in the world right now. Big intensity. People are really often pretty freaked out, and the suicide rates are just killing. Children as young as 5 years old. It's an intense time, but also in a beautiful, amazing time. And we were talking about that before we went on air. What can we learn from these intense times? You know, you see a leader that maybe you don't agree with, or you see, you know, a situation you don't agree with. This is a real opportunity for us to step up and say, wow, you know, I don't want my world to work that way. I want my world to, we're all stronger together. Even Rebecca, you were mentioning your children before we went on air, 7 and 13?
No, 13 and 17. My stepsons, yes.
And how their world is so different, much flatter, as you said.
Yes.
Yeah, the world has changed dramatically. So how do we take care of ourselves and those that we love during these intense times, our mental health? And then also, cancer is a very scary word. I just saw in the news, I was so excited that there was I don't completely understand it, but there was a cancer vaccine that was tried on a woman in Florida, and it cured her cancer. I don't know if that's the right word. But so there's some very, very exciting things happening in cancer, development, early diagnosis, and things like that. So I don't, why don't you talk a little bit about, what you're doing, how you're making sure we can find out soon enough. Early diagnosis is a huge, part of the battle.
Oh, there's so much to unpackage there, Debra. Great questions. Let me tackle, that very first one that you had about the mental health piece, and maybe back into kind of the cancer conversation, because, I think number one, as a community, and as citizens in this world, we need to acknowledge that mental health is a public health issue. We all have mental health. It's not just when we get sick. It's also, we all are at some point on a continuum in mental health at any point in a given day. Sometimes we catch, kind of the cold of mental health, but then some of us have very serious chronic conditions that we have to manage throughout our lifetime. But it's important, I think the very first step is to want to acknowledge that we all have mental health, that we all are vulnerable and can get sick. And it's important to talk about it and seek help. Where it goes off the rails is when we hold back and treat it as a secret, because that's where shame breeds. And mental illness loves shame, and it just builds on that. And so we've got to get rid of that shame, seek help, because there are really effective treatments out there and community support, and people can live healthy, meaningful lives, even with really difficult diagnoses that can be chronic. So, in terms of the whole cancer piece of this, you're absolutely right. There is, I just can't imagine a more exciting time in cancer treatment. Back when President Nixon declared the war on cancer in 1975, and for those of us who are around then, I mean, it's just amazing to think about. You couldn't even really breathe the word cancer, and say it out loud in public. There was so much stigma and shame associated with it. And at that time, there were only about 3.5 million cancer survivors in the country.
Wow.
Because we didn't have the effective treatments that we do today. So along with that shame came often what was a death sentence, really, and in that diagnosis. Today, I mean, it's absolutely amazing that there are 15.5 million cancer survivors in the United States. In the United States today, happening all over the world as well. And believe it or not, it's going to go up to, 18 million, I think, by 2022, and, even more by 2040. The chart's just going way up because for a few reasons, Deborah. We have really effective early intervention programs now. The earlier you find cancer. That's why, folks, get the mammograms, get the colonoscopies, make it happen, because the sooner you can get screened and catch it early, the more likely it is that you can treat it effectively, and survival rates go up. So that's really important. So that's part of why we have so many survivors. Also, smoking cessation programs are making that possible. Also, we have really cutting edge therapies. And as you mentioned before, I mean, there are so many, it's hard to even keep track of. And I have to give a big shout out to my hero. But my husband is a geneticist and CEO of a biotech company developing the next generation of antibody treatments and therapies for cancer. And it's going to be a different world out there in just a decade, even because of these treatments. So with that said, though, we need to talk about survivors, because the very notion of survivorship is changing and is different today than it was even 10 years ago when I had my last episode of cancer, for really two reasons. One, cancer treatment is becoming a chronic condition. People are living for years in cancer treatment, and we know so little about how that impacts them from a mental health perspective. In addition, we still know very little about the post-treatment mental health issues. What is it like to go back to work or reintegrate into your daily life and your family responsibilities? But then on the flip side of that, we now even have a term called previvor. Because of genetic testing, so many people know now about their genetic predisposition toward cancer and the likelihood of contracting, developing the disease, that, what are the emotional and mental health issues associated with that knowledge and the decisions around, early intervention. So we're doing so much work related to this, and it's an exciting time in the field, but at the same time, there are so many needs, and I'm happy to talk about, much more.
Yeah, and it, I talk a lot to corporations, and the number one problem that in their workforce right now that so many of them are very concerned about are these mental health issues. And I was speaking at a bank a few weeks ago, an international bank. They're a global brand, and we were talking about people with disabilities, but I was reminding them that, diabetes, cancer, schizophrenia, depression, all of those things are part of it. And I really saw a reaction from the audience, because often I think when we're thinking about the, inclusion for people with disabilities, people often forget that cancer is part of that. And I think it's fascinating what you're saying about, the mental health afterwards, because I hadn't thought about that, because cancer has been part of my life, and I personally have not walked that path, but my two of my brother-in-laws have, and one was, he was diagnosed with stage 4, had 3 months to live, and the other one was diagnosed with a less invasive, I guess, cancer. Well, the one stage 4 is still alive, and the one with cancer that doesn't kill you passed very quickly. We lost him within 6 months. And so that really confuses. I know it's very confusing. And then my father had lung cancer from cigarettes, which I hate cigarettes because it took my father. But my father survived cancer for 10 years, but the survival really impacted the quality of his life, because at the time, we threw everything at him to kill this cancer, but it killed a lot of other things that his body actually needed. And my father became severely disabled, and he was very, he had a lot of mental health issues associated with it. And it was just very, very sad to watch
Yeah.
my father walk that path. It was very hard to walk. It was like the cure. It was so much harder. It was a very interesting process. So, and I also want to talk just for a moment about the shame and the stigma, because many people, I talk about this on the show often, but my beautiful husband is walking the path of early onset dementia, which is really, really a scary diagnosis. And in walking it, it is not for the faint of heart, but you know, this is our lives. We got to walk it. And for a while, I didn't talk about it because I didn't want to dishonor my husband. I didn't want to. And then I thought, wait a minute, are you ashamed? I really had to do a lot of self-talking to myself about, why are we not talking about it? And if you're not willing to talk about it, you know, are other people going to be willing to talk about it? Because there is no shame. I mean, these things happen. We get cancer, we get dementia, we, you know, we have depression, and it just really means that we're human. And so, you know, how do we have these really, really important conversations? And I had been tracking your work for a long time, but then I started reading your blogs, and I was blown away by your blogs. I thought, boy, these are really, this is powerful, powerful writing. And that's, you know, one reason why I reached back out to you. But it's very powerful, and we want to make sure that the audience knows how to find them. But we do have to talk about these things. We have to talk about the stories, and, you know, I don't know that much about Survivor, the Survivor part of it. And I wonder if other people really understand. I've never really thought about it. I do know that my one brother in law, he's still alive. And watching him and his spouse and his children and his grandchildren and all of us that love him battle this, it really does take a mental health toll on everyone.
Yeah, it sure does. And I think one of the things we really need to do as a society and a community is really change the way we think about survivorship and the labels that we put on it. And I've written about this pretty extensively in my writing, but, you know, what is the image that we have of survivors now? It's about pink balloons and the parades and the, you know, you've survived, pop a cork and, you know, have a glass of champagne, you have a new lease on life and all of that, which is absolutely true. And I don't for a minute, you know, say we don't need these important campaigns, because they're valuable, but they need to be set in a context for other survivors who so often, upon leaving treatment, are left feeling isolated, left with a set of conditions they don't know what to do with, and all too often the medical community leaves them at the curb as they exit treatment because the cancer's gone. Right. The need for medical intervention is no longer necessary. And medical systems have done a really great job, Debra, of developing supports for not only survivors, but their family members during treatment. I mean, the cancer wellness centers and you know, cancer support community and all these different groups are doing a great job. But I guess my mission and focus, and something I really, you know, want to make sure people take home from this conversation today, is survivorship doesn't end when treatment ends. In some ways, it's just beginning. And there's a different set of supports and needs that survivors have as they exit treatment. And I was really startled as I started doing this work and doing the research to discover that the rates of anxiety and depression in cancer survivors are double that. Wow. Double of the general population. And there are also much higher rates of suicide in cancer survivors than the general population, with I think over half of those within 2 years of diagnosis. Wow. And it changes kind of how we think about this and think, my goodness, you know, we're not doing our job in helping people transition from this. And I'll get personal here. It was a life-altering experience the 2 times I had cancer. It not only changed my body physically, but it changed how I thought about myself, what I could do with my life, what was possible. And it wasn't really until after I ended treatment that I became clinically depressed. A time when everybody in my life thought, oh, now she's well, she's okay, we don't need to have the level of support for her anymore. And what that had to do for me, and I can only speak personally about this, but as I talk to other survivors, I'm hearing the same thing. Treatment provides a scaffolding, a structure around a very traumatic event where you have an expected schedule, you have an expected support team, you know what you're supposed to be doing, and there's some kind of level of control that you have over your life when there's that level of regimen, schedule, support. When you exit treatment, that's all gone. The support team who knew you, they're kind of moving on because you don't need them anymore. And so our job as a community, and employers, faith communities, civic organizations, is how do we move in and build that scaffolding for survivors in the community, both physically and mentally.
And I have not heard much about this, and so I know one thing that, you know, my father always walked with this path, and my brother-in-law's walking this too, is the fear of the cancer's coming back. So is that why people are, you know, it must mess with your head so much. I can't even imagine what people are walking, but can you try to try to explain to me why survivors, I mean, it's shocking to think that they survived cancer and then 2 years later, within 2 years, they are committing suicide because they feel lonely and they don't know who they are. Did their body betray them? I imagine all kind of things come into play, but can you just talk a little bit about what we think happens? I mean, once again, you've actually experienced it, but it's a fascinating topic.
Well, you know, and it's, again, screening is so important because, I mean, that is where we get the early intervention. And again, because I'm a 2-time survivor, it was through screening and blood work that we were able to detect that, you know, it had returned. And so we were, you know, really able to address it. So these screenings are really important, but at the same time, for survivors, it's that trauma that never goes away.
Right.
You know, it's always there. Every time you go to the doctor, every time you go for a screening, it's there. And so it's really important that survivors, one, have support, not just when they're in treatment again, you know, but, you know, I've written about the Caring Bridge sites go down after treatment's over, you know, the meal trains, and, you know, after treatment's over, everybody thinks, great, they're celebrating, but that's when survivors need friends and family members and caregivers to support too in these screenings at 3 months, 6 months, 12 months, even 2 years post-treatment, because it never really goes away. And learning to kind of manage anxiety is also an extremely important component for survivors. You know, I know that your all the work that you do is around workplace and kind of the really thinking about, you know, accommodations. And I can't tell you, Debra, how important work was for me during my treatment and immediately following my treatment. And I think it is so important for employers to think about accommodations for cancer survivors. Because now the way treatments are, so many cancer survivors can continue to work while they're getting chemotherapy, while they're getting radiation. And they need to be able to work because of the financial toxicity of cancer as well. We're just beginning to understand the emotional toll the financial aspect of cancer has. So knowing you have that job, but also, again, that structure to support you, you know, to go to work, to do meaningful projects, to have that role other than cancer patient is so important. So great groups like National National Business Group on Health and the National Comprehensive Cancer Network did a whole project together in 2010, 2013 to help employers think about these things and the accommodations that they need to have. So, I really encourage that conversation to continue.
And give us some examples of accommodations. I mean, I immediately can think of some, but give us some examples of accommodations in an employer. And once again, let's think about, and this is why I'm always talking about, work is very important to us individually. It's who we are. So first thing you do, I'm going to meet you, hold out my hand and ask you, so what do you do? It's part of, and that's why it is so harmful to us when we're not included in the workforce, or you just go home and get well, Rebecca. It's like, it really messes with your head, and it really makes you, I imagine, get very confused about who are you, who am I now, which could bring on all kind of mental health things too. But what are some accommodations that employers can do to help people?
Absolutely. So one of the things survivors tell us that is probably one of the most significant challenges associated with survivorship during treatment and even after treatment is fatigue. It's just the nature of the beast. But, that can be combated through accommodations like flex work schedules, work from home schedules, the ability for survivors to have a place at work where they can go and take a nap and just decompress for a moment. We make accommodations for other things in the workplace. We need to think about that for survivors too. They have that need. I think what's really important for everybody to understand is if you think about a survivor, they are somebody you want on your team. You want as your employee, because talk about somebody who knows how to confront a challenge, tackle it, move around it, go through it, find a way. That's a cancer survivor. So let's find ways to accommodate them. So again, fatigue, naps, work from home flex schedules, but also ensuring benefit packages that make sense and support early intervention, support well visits, support free mammograms, things like that to keep your workforce healthy and safe. That's also very important.
And absolutely in the best interest of the employer. Absolutely in the best interest of the employer. And we're human beings. We're going to walk, contrast. We were talking about that on air too. Off air, but it's just part of being alive. And during our the time when we're in the biggest crisis in our lives, you don't want everybody to turn their back on you. And once again, oh, you're cured now. Okay, so, jump back in. And because I remember my father after the walk that he took, and he lived 10 years after he, was cured from cancer. And that word is confusing to me, but he, it was a very difficult 10 years for my father. It was very difficult. And it was difficult for all of us because we didn't understand. And then people also have to think about the people around them too, because I talk a lot, once again, just because of my work, I talk about, my husband's dementia, and the people that confide in me, in that dementia runs in my family, Alzheimer's runs in my family. I am terrified that I'm going to get it. And then just replace the word dementia or Alzheimer's with cancer. It's like, well, my father had it. And, so if you looked at, hopefully my children aren't worried about this, my adult children, but cancer has been on both sides. My mother-in-law died from cancer, breast cancer. My, two of my husband's brothers had cancer. And then it was on my side, and it's rampant. So the mental health issues associated with it affects everybody, including the survivors.
And thank you for bringing that up, Debra, because I don't think we talk about caregiving enough. And as you mentioned at the top of the show, I worked for President Mrs. Carter, and Mrs. Carter recognized caregiving a long time ago as a significant issue and has the Rosalind Carter Institute for Caregiving here in Georgia. But we, I have to drive that point home. The mental health needs associated with caregiving of cancer survivors or those with dementia and other conditions are important, and workplace accommodations for caregivers as well, especially as we have adult children caring for parents and spouses, and things like that are really important. One other thing that I just want to make sure I say in this conversation is human beings are incredibly resilient, and we can undergo incredibly difficult circumstances and survive and end up thriving.
Yes.
And so I want to make sure that I send the message too that most people can go through cancer and really find themselves on the other side doing well. But, my concern is for those who really struggle, like I did both times after I had cancer, and how even those who did well or do well, making sure they have the ongoing supports they need, especially around screenings and some of those difficult things, is also important. So it's important we recognize that.
I agree. And I'm reading, I'm really delving into artificial intelligence, trying to, understand what's coming at us. And there's a great book called AI Superpowers. And the man that wrote it, he walked the cancer path, stage 4, and he talks, and you hear this often, he talked about how much it changed who he was and how it changed the way he saw the world and other human beings. And you often hear people say cancer's a gift to me. And I know that we're being positive and looking for, putting on our rose-colored glasses, but it still is a very complicated topic. And I personally have not walked it myself, but I've walked it with a lot of people that I love. And that's why your writing just really speaks to me. So I want to make sure that we talk a little bit more about how people can find out about the work you're doing. They can read your blogs. I know you're working on a book, you're a speaker, you're working with these amazing organizations on early diagnosis and other things. But, tell the audience more about how they can find out about your work and follow you and support what you're doing and get engaged and involved too, which is
thank you. Yeah, I have done a lot of writing my whole life. That's kind of who I am and what I love. I've had the opportunity in the last year and a half to really begin working on this book that I'm calling Surviving. That's the working title, but that can change. So the title of my website is survivingthebook.com. And but my writing and where you can really settle in and read what I'm talking about in terms of life beyond treatment is the Learning to Live log. And so many of us who are cancer survivors have a second lease on life. We have a second life, but there's so little out there about how do we learn to live, not be a patient, but live. And I think there's lessons there for beyond cancer survivors. There's lessons for a lot of people who might be going through big transitions in their lives, like, empty nesting or a divorce or seeing another loved one through a serious illness. So you can find the Learning to Live log at survivingthebook.com/blog, BLOG.
Yes, and I know you're on social media too.
And it's all on social media. So you can also find me at Rebecca Palpant on Facebook, as well as on Twitter and LinkedIn and all of those places.
Yeah, because we all have to talk to each other. So we've got to, we've got to be on those social media channels too, talking about it. But the work is so important, and I applaud what you're doing. And I think we're not talking about this enough. I just don't think we're talking about it enough. And so I hope you're doing speeches for corporations that are trying to figure this out and trying to help them understand how can they help their employees live their best life. And guess what? Our lives are filled with contrasts, as we walk these paths. And so I don't think anything's more important than these topics. So
Mhm.
we really, really appreciate the work that you're doing, Rebecca. And I'm going to keep checking in, and you need to tell us how we can help. And, I really, really encourage you, the audience, to go and read her blogs and get engaged, because they're really beautiful. You're a beautiful writer.
Oh, thank you.
So I love it. And I'm so busy, but your blog will, and you can get email updates, because I'm on her list. And so it just jumps into my email along with so many other things, but those I read because I find them beautiful and poignant. I learn. It's so important for us to try to understand each other, especially at a time with this we're so intense, and we're trying to figure out, do we all close our borders, or do we all help each other? I vote we all work together and help each other. And how do we live our best lives even after we've survived cancer? Or, I just think it's a very, very important topic. So Rebecca, thank you so much. And let me give you the last word. If there is anything you want to say to the audience, or any advice you have to all of us to live our best lives and support each other.
Absolutely. And I'll end with something I've been doing a lot of thinking about, and that is learning to live is about being in the present moment. And I think if we can be present with one another, like this conversation that we've had, like your colleague in the next cube over, being present and paying attention to one another, I think we can go a really long way in solving a lot of these problems.
So true.
So I encourage anyone who's listening to this podcast, if we have your ears, when you click off, take a moment to be present and think about, one, be grateful for all that you have in your life. No matter how dire our circumstances, there's a space to be grateful, and find ways every day to be present with those around you.
And that's
Thank you so much.
Your writing.
Thank you, Debra.
Thank you for being on the show. And thanks to my audience for all your support. And we really appreciate everything everybody's doing to make the world a better place. So bye, everyone.
Goodbye.